Okay, and with that, I'm really happy to introduce Brad Talbot. He is with the Idaho Department of Insurance with the SHIBA program, which stands for the Senior Health Insurance Benefits Advisors. He's a true expert in Medicare, and he's going to go ahead and introduce himself. But with that, I'd like to welcome Brad. Thank you so much, Brad.
I'm really glad to be here, Kathy. Thank you. And thank you for the introduction. So we're going to get started pretty quickly here. I'm going to condense a 2-hour presentation into our 1 hour. But feel free to ask questions. I'm glad to answer them, and Kathy will provide my contact information if you have more after we're done. Okay. So with that, I'm going to share my screen, Kathy. Just make sure I get this done correctly. And slideshow. Okay, so you should be able to see that now. Are we on, Kathy?
Yep, I can see it, but I can also see your notes.
Oh, okay. Not sure I can do anything about that at this moment. I'll keep trying as we go.
I mean, we can see the next slide is what we can see.
Okay, that's fine. So as Kathy said, I work with the Idaho Department of Insurance. I'm one of half a dozen people employed here at the state who are Medicare experts and available to any of you if you have Medicare questions or problems. That said, I don't try to memorize everything about Medicare. So you will find that just as often as not, I will tell you that I don't know, but I know how to find out, as often as I know the answer right off the top of my head, because this is just way too complex for anybody to try to memorize, and who would want to anyway. Okay, so SHIBA is a program, as I just said, run by the state at the Idaho Department of Insurance. However, there is a SHIBA-like program in every state in the union. They go by different acronyms, but every state does have one, and they're administered by different agencies in each state. What do we do? In a nutshell, SHIBA is a service that is intended to make sure that you have a resource to understand your Medicare. And that's whether you're just getting started, making changes, have questions about how Medicare works, or have serious problems with Medicare, billing disputes or anything of that type. So it is a one-stop resource for you when you have Medicare questions or problems. A few things that we do not do. We are very proud of the fact that we maintain an unbiased stance. So a few things we won't do. We can't sell you insurance. We are not, and we don't allow licensed agents to work with SHIBA. We don't recommend. You may try to get us to recommend something, a company, an agent, or an insurance plan, and we just won't. What we do is make sure that you understand Medicare well enough to make your own intelligent decisions. So with that, we're going to get right into this. I know quite a few of you are probably already on Medicare, so some of this is aimed at folks who are new to Medicare, but we're going to start from the beginning. Timing is important here, as it says. If you miss an enrollment period, that could end up costing you a long period of uninsured, a gap in your insurance, and it can cost you premium penalties later on. So it's important that you make sure you understand the enrollment periods that apply to you. And we are really good at helping you with that. So if you have any questions at all, if you're contemplating a change in your Medicare, making sure that you have an enrollment period and you know what that is available to you is really important. And then being able to take advantage of that. So we can help you with those things. Then you've got to decide if you're going to enroll or not. If you're employed, and turning 65, and you're going to continue working and be insured through your employer, most people enroll in Part A because there's no cost to it and it provides a little bit of secondary insurance for hospitalizations. Most people defer everything else until they decide to retire at that point because there's a cost to everything else in Medicare. And generally speaking, if you're insured through your employer, it's just not worth the cost. Because all those things will pay after your employer insurance has already paid the bill. If you have questions about that, again, we can help. It can be a little more complex than that, but in a nutshell, if you're turning 65, you've got an initial enrollment period. If you're going to continue working, you can defer everything until you decide to retire. And about 3 months before that retirement date is when you should start to think about getting enrolled. So there are two agencies that get confused and wound up in Medicare. They have two distinct rules. Enrollments, when you enroll in Parts A and B, which is the federal health plan, and what they call original or traditional Medicare, you enroll through Social Security Administration. Okay, you can't call Medicare or go online to Medicare and enroll in Parts A and B. You have to do it through Social Security. The easiest way is ssa.gov. It takes about 10 minutes to get enrolled on that website. It may take you several days to get somebody on the phone at Social Security these days and get an appointment. So your payments for your Medicare and your enrollment in Parts A and B will be handled by Social Security. Your benefits and the services that Medicare provides will be administered by Medicare. So that's the distinction. Once you get enrolled in Parts A and B, this is what you're going to get from Medicare, is a card that looks like this. It will say, importantly, it will have a Medicare number, as you see here, and it will have hospital Part A coverage and a date that it starts. And if you're enrolling in Part B as well, it will state that also. This is the card you're going to use at the doctor or hospital if you stay with traditional Medicare, so that the provider knows that they're billing Medicare for the services. Okay. Oh, and this Medicare and You book is should be delivered to you. Once you've enrolled, it'll be delivered to you every year. It's updated every year. A few things change. And so you'll look for an updated version every year. Has important information like what services are being covered 100%. This year, they always add 1 or 2 new ones. So important to keep track of that and other important changes. Let's talk about the initial enrollment period. This is when you're getting started, if you're turning 65, or if you're eligible due to disability. Those are the two main reasons people are eligible for Medicare. So you have 3 months prior to your eligibility month. So for somebody who's turning 65, that's the month that you turn 65 is your month of eligibility. The 3 months prior to that, you can enroll in Parts A. I suggest that you enroll in Part A and B if that's what you're trying to do in the first month of your eligibility. That gives Social Security plenty of time to get it all done correctly and have it ready to start the first day of your birth month. And that's what will happen. Anything you enroll in these first 3 months will begin on the first day of your 65th birth month. Okay. If you put things off and you enroll in Parts A and B or anything else in the month of your birthday, your coverage will begin the first day of the following month. If you enroll in any of these final 3 months of your initial enrollment period, there'll be a 1 month delay if you enroll in this month in the 4th, 5th month. If you enroll in the 6th and 7th month, there'll be a 2 month delay. So that can start getting complicated. It can lead to gaps in your coverage. And as you know, anytime you put things off, bad things happen. And if something can go wrong at Social Security with your enrollment, this is generally why. I can't explain exactly why, but folks who put things off till these last 3 months tend to be the people who have problems getting that enrollment done correctly. So I really encourage you to use these first 3 months if possible. Okay, I'm going to skip through this really quickly. There are other enrollment periods. For instance, if you decide to defer Part B and everything else because you're working, you can enroll in everything else up to 2 months prior to your retirement. So that would be the time to start thinking about that. And you also have up to 8 months after your retirement. So there are, as many of you may know, there are premium penalties that you incur if you have a gap in coverage. Medicare allows you an 8-month gap. If your employer coverage were to end, say in January, you could go all the way to the end of August after you retire and not incur that premium penalty and enroll in Medicare in any one of those 8 months. Not what I recommend, but you're going to be able to strategize. So that's a possibility. Kathy, we have any questions so far?
Brad, a question just came in that an agent told this person they didn't have to worry about Medicare enrollment since her husband was employed and not 65 yet. He will now be retiring this March, and there was confusion about this. So if you could maybe address that.
Oh, awesome. Yeah, great question. So I failed to mention that your spouse's employer insurance counts. So if your spouse is employed and you're insured through your spouse's active employment, you're covered, and you can defer enrollment in Medicare until your spouse retires. So in this case, she's going to need to start considering enrollment in February or January for a March retirement date. Okay.
Brad, there was another question really fast. Is there a penalty for taking advantage years after starting Medicare? I'm not sure what that means. Is there a penalty for taking advantage?
I think I can address that pretty quickly. So there are two premium penalties that you're in danger of if you delay enrollment. If you don't have what Medicare calls creditable coverage, and Medicare defines this. So your employer plan is generally creditable, meaning it's as good as Medicare, and Medicare won't charge you a premium penalty if you have it. But if you don't have coverage, or you have some kind of plan that isn't creditable, and you delay enrollment after you're initially eligible. So if you turn 65 and you wait a year to get Medicare, you'll incur a Part B penalty. That's 10% of the Part B premium for every 12 months you don't have it. So if you went that 12 months without Part B, you'd pay a $14 premium penalty that would get tacked on to the monthly premium for Part B every month for the rest of your life, or for as long as you have Medicare. There's also a Part D penalty. If you have a coverage gap in prescription coverage for 12 months, the penalty for Part D is 1% for every month you don't have it. And it's 1% of the average premium, which is about $33. So if you went that year without Part D, you'd pay something a little under $4 and premium penalties that would get tacked onto your monthly premium. And again, it's every month for as long as you have Medicare. So they're not terribly expensive penalties. And it's, this is common insurance. If you went a year without auto insurance and then you decide you want auto insurance again, you're going to pay a higher price for it. That's just the way it works. So this is no different, but that's the two premium penalties that you're in danger of if you delay enrollment. Anything else, Kathy?
Yeah, really fast. The person is, started on Medicare, didn't delay anything, but wants to think about Medicare Advantage down the road. And then you had one quick question about, they have employer coverage, basic bronze. There's a $13,750 deductible. Does it make more sense to jump to Medicare than to stay with the employer plan?
It could. That's a really high deductible. So certainly improve on that if you went to Medicare. I couldn't say much more than that without really having details about the policy, its costs and coverage, but that's a really high deductible. And so it would be worth taking an hour to meet with one of our counselors and look at the options. I think they'd find that it's probably a good idea to make a switch. Okay, with that, we're going to jump into Medicare basics. I know Medicare, everybody says Medicare is really complicated and it's hard to understand. You can really simplify it though, especially, well, you can just simplify it. There are really only 5 parts to Medicare. There's the federal health plan, which is part A and B. And then there are Medigap plans, which are also called Medicare supplements because they supplement part A and B. And then there are Medicare drug plans, which is part D, and part C, which are Medicare replacements. They're insurance plans that you get from private for-profit insurance companies that replace parts A and B and provide some additional benefits that part A and B don't. Okay, so really, if you're getting started in Medicare, you're turning 65 or your eligibility because of a disability is coming due, then you really don't have one major decision because you're going to get part A and B at some point. That's the bedrock piece. You're going to get drug coverage in one way or another. What you've got to choose between is how you're going to cover the things that Medicare doesn't. And you only have a choice between two pieces, Medigap and Part C Medicare Advantage plans. So really, it can be really simple. You're going to choose how you're going to get your Medicare covered, Part C or a Medigap. Okay, so we're going to talk about all those things now. Okay, first thing we're going to cover though is Part A and B. I like to simplify this as this says Part A covers in addition to hospital stays, inpatient skilled nursing care, some home health care and hospice care are the main benefits it provides. I call Part A inpatient coverage because it doesn't cover anything unless you've been admitted to the hospital by your doctor. As you may or may not know, and a lot of people don't know, so I like to repeat it. An inpatient, you can be in the hospital for days or even weeks and not be an inpatient. You can be in the emergency room, in the ICU, or be having surgery as an outpatient. Part A will not pay if you're not an inpatient. Okay, so an important distinction. Part A and Part B then conversely is outpatient coverage. It covers you in the hospital if you're an outpatient. So that could be, a hip replacement surgery, outpatient surgery. It's also your doctor's office, emergency room, anything else. Cover some other things, but the most important thing to know is you've got inpatient coverage and outpatient coverage. Generally, for 98% of people, there's no premium for Part A. Part A, you've paid for as you've worked throughout your life, and so you don't have to pay for it once you get Medicare. Okay, so this is why most people enroll in Part A, even if they're going to continue to work, because it provides that little bit of secondary hospitalization coverage. There is a deductible associated with Part A. So if you're keeping track of how much this is going to cost you, this is where you're going to start. The Part A deductible is $1,400. It's actually getting close to $1,500 now. And it's more complicated than this, so we're not going to get into the real details, but it's per occurrence in essence. So every time you're admitted to the hospital, you're at risk of having to pay the $1,400 Part A deductible. I don't know about you, but in my little world, that would be a little disastrous if I had to pay the $1,400 deductible. So most of us want to get a way to cover that deductible. And that's why I want you to keep track of this cost. We're going to look at ways to cover that.
Brad, there was a quick question about, can you say a little bit more about inpatient and outpatient? And also there was a question going back to enrollment, but if the spouse, does the spouse have to enroll even though she's not 65 when this person plans to retire in 1222?
Okay, so let's go back to the spouse really quickly. Let's starting to get into more detail than I get into here today. So that might be something you need to call me about. But if the spouse isn't Medicare eligible, she's going to, the working spouse is going to retire. The working spouse may need to get COBRA coverage and keep their plan, or maybe the company has arrangements that allow them to keep that plan into retirement so that they both can be covered by it. In some cases, they may have to pay COBRA, or their other option would be an Obamacare plan from Your Health Idaho until she reaches 65 and can get on Medicare. So those are the options there. What was the second question, Kathy?
It was, if you could just talk a little bit more of inpatient versus outpatient.
Okay, so inpatient care requires a physician, could be your surgeon, could be an emergency room doc. Somebody has to sign a paper that says, and I don't know what the criteria are, but it's a formality that has to be completed to make you an inpatient. You have to be admitted to the hospital as an inpatient. That's kind of the terminology. If you're, as you may or may not know, like I said, hip surgery, for instance, which to me just sounds, and I've seen a couple of them done, and it's a horrible looking process, but they do it as an outpatient, even though you may spend a night in the hospital. A lot of these folks in the ICU right now with COVID, they're in there as an outpatient, unless I think once they get intubated, they're admitted. So I don't know what the criteria is for, now they need to be admitted. I just know that you can be in the hospital for a long time and not be an inpatient. So it's something you need to, you or your representative family member needs to be asking if you're in the hospital, am I an inpatient or outpatient? Especially, if all you have is Part A, because Part A will not pay anything if you're an outpatient. That's kind of really all I can say about that. If you are admitted, you're going to have a $1,400 deductible to pay. That's the first thing you need to know. Part A pays 100% of the rest of the cost up to 60 days in the hospital. Okay, so it's really pretty good insurance. It's way better than the PPO I have here at the state. So despite the deductible, that's pretty good all by itself. Okay. Some more detail about skilled nursing. If you have questions about skilled nursing, give me a call. But you don't get skilled nursing care until after you've had an inpatient hospital stay, and Medicare pays for 20 days, 100%. And that's therapies that you have to get in a skilled nursing facility. We already kind of pretty much covered this. Should you take Part A? Probably, yeah. It doesn't cost you anything. It's going to take you 15-20 minutes to get enrolled. The only people who shouldn't take Part A if they're going to continue working are people who haven't worked 10 years. So in that case, you would have a Part A premium, and it probably wouldn't be worth it. Okay, any other questions about Part A before we jump to Part B?
Brad, there was just a quick, I think you clarified it, but during COVID, because there's no rooms, like in some hospitals, and you're put in the ICU, are you covered by Medicare?
Yes, yes, you are. You would be covered by Medicare if you can get in. Get in the hallway or wherever they're storing people these days, Medicare will cover it. Part A and B would combine, whether you were inpatient or outpatient. Okay, so Part B, outpatient care and services, including some of those that are listed here. In general, Part B, if Part B is going to cover it, and this is in the hospital, emergency room, ICU, in your doctor's office, wherever you are, if Part B covers a service, it's going to pay 8%. Okay, now there are these blue apple symbols here are used in that Medicare and U-book to indicate a preventive service, things like colon cancer screenings and things like that. Medicare covers those under certain conditions 100%. And if you see this blue apple symbol, that's 100% covered service. Everything else, Part B pays 80%. So it's really simple to understand, right? If you have a $100 bill and you have Part B, your share of the bill is going to be 20%. Okay, so this is the second expense that I want you to keep track of. This is really the big one. This is why people go bankrupt due to medical bills. There is no cap on how high your 20% can go. If you have a $100 bill, you're going to pay 20. If you have a $100,000 bill, you're going to pay 20,000. So we definitely want to get away to put a cap on how much you might owe in a Part B situation. Does that make sense? I hope that makes sense. The other costs associated with Part B, those Social Security taxes that you pay all your life, they go to pay for Part A. They don't pay for Part B. So there is a monthly premium associated with Part B. It's $148.50 a month. This year, we still haven't heard what it's going to be next year. If you're on Social Security, you know, you just got a 6% raise for next year. Most of that's probably going to go to a raise in Part B premiums. That's the dirty little trick they play on you every year. So congratulations. Let's see. What else do I need to tell you? There is also a $200 a year deductible, and we'll talk about ways to get that covered. So that's not huge. So it usually doesn't factor in, but that 20% coinsurance does.
Brad, there's a question how Medicare works for married couples.
It doesn't. As far as Medicare is concerned, they don't care if you're married or single or whatever you're doing. You've got to get your own Medicare. So each of you will have Part A and B. You'll each pay a Part B premium. Each of you will have and make your own decisions about whether you want Medigap or Medicare Advantage plan. Okay. So as far as Medicare concerned is, you're just an individual. Unless you're married and you're making over 100, as it says here, $176,000 a year, then they'll use that number to charge you a higher Part B premium. That's the only time when it matters. Okay, so if you're going to continue to work and be insured through your employer, and your employer has 20 or more employees, you should probably delay Part B. It provides a little bit of secondary outpatient coverage. It's not worth $148 as a secondary plan. So most people just delay that. Okay, so now we're at the crux. I told you you had one decision to make when you're starting Medicare. This is it. Do you want to stick with original Medicare? That's Part A and B with a drug plan and supplemental coverage, a Medigap plan, or would you prefer to go with a Medicare replacement, a Medicare Advantage plan that includes Part D and some extra things? So we're going to start trying to figure that out now, okay? We're going to start with the supplemental coverage. This is the oldest piece of, this has been around for about 40 years, I think, these Medicare supplements or Medigap plans. as they're called. These really they supplement Medicare Parts A and B. They're very, very simple and easy to understand, which is why I start with them, and most of us have never heard of them. So it's a little surprising to some of us. It worked really simply. If you go to the doctor or the hospital, the provider is going to bill Medicare Parts A or B, whichever is appropriate. And if you have a Medigap plan, Medicare will pay its share and then send the balance of the bill. And it could be that 20%, it could be the Part A deductible. It'll send the balance of the bill to your Medigap plan, and your Medigap plan pays it. That's all they do. If Medicare pays, they pay the balance. If Medicare doesn't pay, they say, oh, no, this is not covered, Medicare covered service, we're not paying. The Medigap plan pays nothing. Simple as that. So there is a range of these things. They call them plans A through N, A, B, C, D, KLN, weird alphabet, but that's the clever naming system they came up with. I'm going to tell you right now, there are only a few that we find. Some of these are just dinosaurs that are left over from another time, and the prices are too high to make them worth considering. The ones that are worth considering are if you were 65 in 2019, you can get a Plan F. If you turn 65 after that, your most comprehensive plan is Plan G. We also sometimes talk about Plan N a little bit, although frankly, the prices on Plan N have risen to the point where I almost don't talk about it much anymore, but it is a little less expensive than F and G. And then I think it says up here, it mentions a high deductible plan. Yeah, right here, Plan C, F, C and F and G as well have a plan with a high deductible, or what they call a high deductible. And those are the ones that we generally talk about. So for most folks, and the most common plan that people look at is Plan G, even if they can get a Plan F. And the reason is you can get a Plan G. The only difference between the two is Plan F pays the $200 Part B deductible and Plan G does not. And you can get Plan G for about $300 a year less than Plan F. So it just makes a little bit of economic sense.
I had a quick question on Medigap. It says Medigap always pays 100%. So what is not paid otherwise with Medigap?
Not sure I understand the question. Let me just reiterate. Let's start with Plan F. If you have Plan F and Part A or B cover the bill, or their share of the bill, Plan F pays 100% of the balance. If you have Plan F, you will never see a doctor or a hospital bill. And if you do, they've done something wrong and they'll fix it. Okay. So as you can see here, some things, now when you get to Plan G, you see that the Part B annual deductible, the $200 deductible, is not covered. That's the only thing not covered on G. So first time or two you go to your doctor's office, you'll pay up to $200. And once you've spent $200, then you're covered 100% for the rest of the year. On Plan N, you also have copays at your doctor's office. When you go to any doctor, you're going to pay a copay. I think it's $20. And Plan N doesn't cover excess charges, which are way more complicated than I want to get into for this, because I don't know what time it is. Yeah, we really need to keep moving. So if you have questions about this chart is available at the Department of Insurance website, doi.idaho.gov, and easily accessible as well. So we can go over that if you have more questions about that, okay? So the high deductible option, I think, is a really good option. Not enough people consider it. It has the Plan G high deductible it's now $2,400 deductible. It's not a true deductible though, because you still have part A and B paying their share until you reach that $2,400 spending, and then you're covered 100%. And we had that lady, so somebody asked earlier about their plan that has a $13,000 deductible, right? So way better than that. And if you compare this to the Medicare Advantage plans that we're going to talk about in a while, they also give you, this is the Medigaps are catastrophic protection. Remember, what we're really trying to protect you from is that 20% coinsurance, that Part B coinsurance. The Advantage plans put a cap on your spending by providing an out-of-pocket maximum for all your spending, but those out-of-pocket maximums average $5,500, so more than twice as high as the Medigap high deductible. And you get a Medigap Plan G. If you got a Plan G, you'd be looking at right around $150, $160 for somebody who's turning 65. You can get a Medigap high deductible, as you can see on this rate sheet. If we look at G, actually you can get, if you shop really hard, 140 or even 133, 129. But G high deductible, $38 is the lowest. So you can save about $1,000 a year in premiums in exchange for paying that $2,400 deductible, which is something I think more people should consider, especially when you're comparing the Advantage plans. So why would you, now we see these premiums, and if we're keeping track, you're going to pay the $148.50 for Part B. You're going to pay, let's say, $140 for a Plan G. If you go with a Medigap, which is pricey, right? We're getting like $280, $290 a month. So we'll keep track of that as well, and we'll compare that to the Advantage plans. Two reasons you would consider a Medigap plan. One, they're really easy to understand, right? Medicare pays, they pay. No doctor or hospital bills. So it makes it really easy to plan and budget for your medical expenses. You pay the monthly premium, and you know what your out-of-pocket medical expenses are going to be, whether you go with a G and have a $200 deductible, or a GHD and you have a $2,400 deductible. That's the most you'll pay out of pocket in any given year. This protects you from those medical bankruptcies that we read about and terrify all Americans, right? These rate sheets are also available on the Department of Insurance website. They're updated monthly because they're regulated by the states, not the federal government. So doi.idaho.gov, where you can go to find these. There's one for every age group by every 5 years. And you can get a Medigap anytime you want, as long as you're healthy. Medigap companies are allowed to ask about pre-existing conditions, and they can decline you based on those, except when you're first eligible. You've got a 6-month window when you first enroll in Medicare, and during that 6-month window, you can buy any Medigap plan you want, no questions asked, at these rates. Okay, so that's why this decision is really important initially, right off the bat, because if it's important for you to get a Medigap plan, you need to do it right away. Why would you want a Medigap plan and not a much less expensive Advantage plan? If you have serious chronic conditions already and you're starting Medicare, this is going to protect you. If your medical expenses are not likely to get smaller as you grow older. So this protects you. And if you have chronic conditions, you're in danger of not being able to get a Medigap down the road because of that 6-month window. So folks like that, we really encourage to consider a Medigap right off the bat. Also, with Medigap, you keep the federal healthcare system, the Part A and B, which allows you to see any doctor or hospital anywhere in the country, no questions asked. There's no prior approvals. You don't need referrals. If you want to go see a specialist in Seattle or Salt Lake or Boca Raton, you can do that, and Medicare will pay. That's as opposed to, most of us have gotten used to what they euphemistically call managed care plans, HMOs and PPOs like Obamacare, or what most of us have at work, that require you to see network doctors and hospitals or not be covered if you go out of network, right? So this is entirely different, and that's one big advantage. So again, another reason why people with serious health issues to begin with should consider going in this direction. Now, the other thing to remember is that with a Medigap plan, you still need Part D. None of these Medigaps don't cover prescriptions, so you'll need a Part D plan in addition. So you're looking at right around $310, $320 a month to be fully covered if you stick with the traditional Medicare with a Medigap plan. And that's the $148.50 for Part B, about $140 for a Medigap plan, and about $20, which is probably high for most of us, for a Part D plan. Any questions, Kathy?
Yeah, there were just a couple of questions I think you clarified, and I did share the charts that you were referencing with everyone.
Okay.
Let's see, the first one is, let's see, are the plan payments you're mentioning monthly? I think you just answered that. How do you convert from Plan F to a Plan G? And let's see, is there a premium penalty for getting Medigap or Advantage years after you've already started Medicare?
Okay, so premium penalty, start with that. No premium penalty for starting one after, later. Part B and D are the only pieces that have premium penalties associated with them. You can change from one Medigap to another anytime you want. There's no enrollment periods associated with them currently. That may change in the coming year. But right now, you can change anytime you want, as long as the company is willing to sell you a new plan. So they will ask about your health, and they can make their decision based on that. But all you have to do is apply. What else was there?
Let's see. I think you have answered all of the questions.
Okay. All right. You know how to reach me if you have more Medigap questions. I like to point out to folks that 67% of people starting Medicare enroll in a Medigap plan. You'll hear a lot of hyperbole about Advantage plans and how popular they are. Well, that's how popular they are. They are tending to grow in popularity as they keep being allowed to roll in more and more bells and whistles to their coverage. So that's changing, but still Medigap plans are really popular.
Brad, just a quick question, like with some Medigaps, you still have to pay for vision, dental, hearing, as well as a drug plan. Just to clarify that.
Yeah. If Medicare doesn't cover it, Part A and B, then the Medigap plan is not going to pay anything towards it. So that's Medigap. Now we're going to jump in, since we're going to need Part D with Medigap. We're going to talk about that next, and we are getting really short on time. So I'm going to roll through this pretty quickly. Really simply, this is your drug coverage. If you need a prescription and you want help paying for it, you need Part D. There is nothing else in Medicare that's going to do that. You're going to pay a monthly premium for Part D. This is $710 to $123. That's this year's prices. I know there's a $6.90 premium plan next year. I don't know how high they go. I think it's a little higher than this. They all have many of the plans have deductibles. They're as high as $445. Those deductibles only apply to name brand drugs, though. So if you have what they call tier 1 or 2 generics, then even if the plan has a deductible, you won't pay it. So that gets confusing when people are looking at the literature. And then it's important to know that all plans don't cover all drugs. The only way to choose a drug plan is to compare your drugs with the company's formulary, every company's plan and every formulary. And the only way to do that I'm aware of is the tool that we use, and you can use it yourself. It's Medicare.gov Plan Finder. You just go to Medicare.gov, hit the button that says Find Health and Drug Plans, and it'll step you through, and you'll be able to compare every drug plan that's available in Idaho with your drug list and see which one is going to be most effective for you. It's the only way to do this. And if I don't discourage anybody from using an agent or anybody else. We're glad to do this for you. But if you do use somebody to do a plan comparison for you and they don't show you there are 22 plans next year. If they don't show you every one, be suspicious. It's my only warning. So I often get asked, what if I get a new prescription in the middle of the year? Can I change plans? And my company doesn't cover it. No, you don't get a special enrollment period if you get a new prescription and it's not covered. Or yeah, you just don't. You can appeal to the company to change their policy, and we can help you do that. Sometimes those are successful, but there's no special enrollment period for new drugs. There's really, you can only really choose these. You can only really change these during the open enrollment period, which is December 7th through October 15th every year. Also, there's 3 levels of pharmacies, as it says here. There's out-of-network pharmacies where you'll pay full retail, and there's network pharmacies, and then preferred pharmacies where you'll get the best rate. So Plan Finder allows you to choose 5 pharmacies to include in the plan comparison. So you can really zero in on not only the plan that works best for you, but the combination of which plan and which pharmacy you should be going to. This is kind of, I don't know why this is here. This is a little piece of a Plan Finder plan comparison, kind of what it will look like, but not really. So I need to ditch this slide. Let's just move on from there. Enrolling in Part D is just like enrolling in Part A and B during your initial enrollment period, that 7-month period when you turn 65. And then if you move out of state, you get a special enrollment period to change plans. These plans are all associated by state. So if you come or go, you're going to have to change your drug plan. And there are other reasons you might get a special enrollment period. So all the ways you can enroll. Plan Finder, by the way, if you use it, there is an enroll button next to every plan. So if you use the Plan Finder to do a plan comparison and you find one that really works for you and you're confident about that, you can hit the enroll button and it takes 5 minutes to fill out the form and enroll in a new plan for next year. If you call us to do it, that's what we're going to do for you. And we're glad to do that. It can still get confusing. So we're happy to do that for you. Okay, so I'm not going to take any more questions because we're really up against it, and I want to get through the Advantage plans. This is, you're watching TV and you're picking up your mail. You're getting inundated with marketing messages about Medicare and all the extra benefits you may be eligible for, right? Everybody's eligible for them. That's the first big secret. You just have to choose an Advantage plan to get them. And everybody's eligible for Advantage plans, no questions asked. All those advertisements are trying to do is trying to get your contact information so they can send stuff directly to you, right? And sell your information to other companies so they can do the same. So stop watching the advertisements. You already know all you need to know about them. All that stuff's available to you. One thing I'll address really quickly, they are advertising plans that will pay your Part B premium for you. There are only 2 Advantage plans that do that in Idaho. They pay less than $50 of your Part B premium, and they don't include drug coverage. So they probably don't make sense for any of you. So forget about that. So let's carry on. These are, as I said, Medicare replacements. If you go with one of these are what are called managed care plans sold by private insurance companies. They take the place of Part A and B. So they have to follow Medicare's rules, but they can do things much differently. One, they require you to see network doctors and hospitals. So if you're buying one or you're changing from one to another, you've got to make sure that your doctors and hospitals are in network. There's a range of premiums, and there are some very good Advantage plans that have $0 premium. So basically they're free, which is a really good deal. And they are associated mainly with a by zip code or by county. So if you move from Canyon County to Blaine County, you're going to have to change Advantage plans more than likely. Okay, so important to know. And if you move out of state, you're definitely going to have to choose a new Advantage plan. Most of them include Part D, so that's kind of a convenience feature that a lot of people like. And they include things like some dental and vision coverage, health, fitness benefits, discounts at fitness clubs, those kind of things. They also, some of them include over-the-counter medication benefits. So those extra benefits can add up and can be really important for some people. That combined with the low premiums means that these are plans that you would choose if, one, you just can't afford a Medigap. If it's just not in the cards for you, you'd be looking at Advantage plans. Two, people who are really healthy and don't want to pay for a Medigap because they don't see the reason for it would look at Advantage plans. Or if some of these extra benefits are really what you need that you can't get from Medicare otherwise, then this would be an option for you. Okay. It says $0 to $140 a month. That's pretty much what I've seen for next year as well. Most of them do not have healthcare deductibles. Most of them do have copays at the doctor and specialists. And you compare these plans really the same way you compare a drug plan. The first biggest expense most people have is their medications. And it's the only known expense for most people. You don't know which doctors you're going to see or need in the coming year, but you do know you're going to keep taking your atorvastatin and your Cinepril or whatever, right? So those are known costs. So if you use the plan finder, we do that for you. We're going to use your drug list in the plan finder to compare these plans. And what you get is a number that adds the monthly premium plus an estimate of what your drugs will cost at each pharmacy. And it'll give you a true out-of-pocket cost for the year. And that's the number it's going to use to rank each plan. And then you can compare them side by side and make sure that any plan you're considering has a reasonable reasonable benefits when you're in the hospital or you're getting therapy, and you can compare the dental benefits and those kind of things. So it's more complicated than a drug plan, but you start with that same number, that cost of your drugs, because that's your known out of pocket. So it says here, these are how you're going to compare. Oh, out of pocket limits. So remember, the reason we want a Medigap or an Advantage plan is really to protect us from those catastrophic expenses that would bankrupt us. The Medigap plan does that really simply. The Advantage plans do it by giving you what's called an out-of-pocket maximum. So you will continue to pay copays or co-insurance, some share of the cost every time you use services until you spent a certain amount. And with Advantage plans, that ranges from about $4,500 to over $7,000. So you're going to spend, if you have a really bad year, that's what you'll end up spending out of pocket, which is much higher than the 200 or 0 to 2,400 with a Medigap plan. You can, unlike the Medigap plans that you can change anytime you want, basically, with the Advantage plans, you can only make changes. You can make changes during the open enrollment period, October 15th to December 7th. And since 2 years ago, they also make you or allow you to make changes from January 1st to March 31st. So there's a really broad window. But outside that period, you would need a special enrollment period for something like a move out of the area in order to make a change. Anything else I'm missing here? I don't think so. Okay, almost winding up here, Kathy. I do want to touch on this. There is help for people who struggle. Let me back up really quickly. So how do you choose between Advantage or Medigap? One thing I point out, the people who have the hardest time making this decision are the ones who are both able to afford a Medigap and so healthy they don't want one, right? So those are really fortunate people. They're both healthy and wealthy. I don't cry for them because they have a hard time choosing. They're just going to have a hard time making a decision. If you just can't, if $40 to $140 a month is outside the budget, and for a lot of us it is, then a Medigap isn't going to be a choice for you, and you're going to go with an Advantage plan. If you have those serious chronic conditions already, then you really need to find a way to pay for a Medigap. I mean, unless this is just impossible. So there's my guidance on that. There is help for people to help pay some of these expenses. 2 places you can get it. The state of Idaho, Department of Health and Welfare, has 2 programs. The Medicaid program that acts like a Plan F, Medigap plan. If you have Medicare and Medicaid, you'll never see a doctor or hospital bill. The income limits are really strict in Idaho. You can't make over $800 a month or you're ineligible for Medicaid. But there is something called a Medicare savings program that you may be eligible for. They, depending on your level of qualifications, you could get your Part B premium paid for, you can get doctor copays and the coinsurance paid, and you get enrolled in extra help from Social Security. That's a program that helps with the drug costs. It'll pay for a drug plan, and it pays virtually all of your copays at the pharmacy. So that one in particular can be a real lifesaver. We have somebody with a lower income, and the income limit for extra help is a little over $1,600 a month. So anybody whose income is at that level should really be applying for extra help. It can be a lifesaver when they've got an expensive medication. If you have full extra help, the most you will pay for any medication, no matter how expensive it is $9 and change. Okay, so let's see. Help paying, what is extra help? We said that. What are savings programs? Covered that. Really rushing through this. Sorry, I'm already over our time. You can get this brochure from us or at the Department of Insurance website. It has the income and asset limits for Medicare savings programs and extra help. So it's a great tool to use if you know somebody who might benefit from one of those programs. You can help them out by showing them that. So with that, Kathy, questions?
Well, first, thank you so much, Brad. That was like a marathon.
Right?
Yeah.
I have to stretch out my tonsils a little bit.
Yeah, no, that's a long time to talk. I think There was just one quick question, just about the 6-month rule for Medigap, as the same for Medicare. The husband's still working on the company insurance, but retiring this month or this March. 6-month rule for Medigap. That's the one question that came in.
Okay, let me jump to that real quick. So and I'll just tell you, we rushed through a 2-hour presentation, so obviously I simplified a lot. So many of you shouldn't jump to conclusions based on this, frankly. And one of the things I simplified was your eligibility for a Medigap, no questions asked. If you enroll in a Medigap when you're first eligible, you have 6 months to do that. From the day your Part B starts, that's when the clock starts ticking. And you have 6 months if you want a Medigap. If you enroll in an Advantage plan on day 1, so if your Part B and your Advantage plan start on the same day, you actually get 12 months to change your mind and get a Medigap plan, no questions asked. So you can actually game that out. And I have a lot of people who really want to get some dental work done right away. So we enroll them in a good Advantage plan, and they get their dental work done in the first 6 months and then change to a Medigap. So that's a possibility. What else?
So it was just a question about, like, the follow-up. I mean, maybe you could talk about, how to get an appointment and the value of meeting with a SHIBA counselor for all these questions.
Mm-hmm.
And then a question about, like, what I'll be sharing. I will be sharing the recording. I'll send you all the links that we talked about today. The PowerPoint, Brad, I don't know if that's available to be sent out.
Mm-hmm. Yeah, you've got a copy of it.
Okay.
You're welcome to share that. This is our helpline right here. If you want to call there, you can make an appointment to talk to one of our counselors. And if you do that, they're going to spend all the time you need to ask all the questions that you have. If we do a plan comparison for you, we're going to we're going to compare every single plan available and make sure that you're considering the 2 or 3 most effective plans. Sometimes it'll be really obvious which one is best for you. And sometimes there will be a handful that are kind of, you'll have to make a harder decision. But we're going to make sure that you understand what you're getting into and can make those decisions with confidence. Also, as I mentioned right at the top, if you have problems with any piece of Medicare, the Department of Insurance is really your best resource for getting those resolved in many cases. I mean, the first step is always to contact the insurance company or Medicare and find out why the problem is a problem. And if they can't resolve it, then you can come to us and we can help you resolve it because we have contacts, those people who are high enough up to actually be able to make decisions. We can get a hold of them. I'm glad to do that. What else?
And is there a cost to have a SHIBA counseling session?
SHIBA is the best bargain you're going to find because it's all paid for by insurance taxes. So no, there is no cost to you.
Great. All right. Let me see if there's any other questions because we are out of time. I cannot recommend spending every year annually going to a SHIBA counselor for the high cost of free to compare all of your different plans and see if you can save money, and as your healthcare changes to see what your options are. Just cannot recommend their expertise enough. So with that, we're going to go ahead and end the session. You'll be getting an email from me. And I just want to really thank Brad for doing this and getting the word out, and just thanks the Idaho Department of Insurance. So thank you so much.
Anytime, Kathy. Y'all take care. Hope to hear from some of you.
Okay, sounds good. Thanks, everybody.
Super.
Thanks. All right. Goodbye.
Hi, everyone.